Assalamualaikum warahmatullahi wabarakatuh. This is the final year project video presentation entitled Determinants of COVID-19 Infection in Selangor. Our group was supervised by Madam Jaidah Najiha binti Jamidin. The team members are Aina Fariha binti Khairul Azam, Fazlin Shahira binti Nizan Shah, and Zirwatul Hanani binti Muhammad Ali.
SARS-CoV-2, or also known as COVID-19, is pestilence of infectious disease among humans. Initially, this virus started in metropolis town, Hubei Province, China. In Malaysia, Selangor has recorded the highest numbers of confirmed COVID-19 cases. According to Sam et al. 2020, it found that Selangor has 0.05% highest than the other state in Malaysia for period prevalence of confirmed cases.
The COVID-19 pandemic has been ongoing for over a year. The total number of cases exceeds 147 million with more than 3 million deaths. According to the Malaysian Ministry of Health, state of Selangor had recorded the highest confirmed cases. The first objective of this study is to investigate the factors that contribute significantly to the COVID-19 infection. The second objective is to obtain the best logistic model in determinants of COVID-19 infection.
The purpose of this study was to acknowledge and provide contributions, especially to Ministry of Health Malaysia, doctors, frontliners, and society. It also aims to provide valuable information towards community concerning the risk factors that could be triggered and infected them, predicate on their lifestyle and criteria. It also aims to examine their exact preference on how to be more sensible with probability getting infected. For the scope and limitations, the age has become the limitations. The majority of the respondents were 18 years old and above. Those who under the age of 18 required the consent of their parents or guardians. The data obtained in this research can only be used in this case study. It will not define the whole population of the community area.
Age is defined as the length of person existent from birth to death. Rosenfeld et al. 2020 show older age is associated with a higher risk of COVID-19 infection. However, the youngest than 40 years old are still at risk of being infected by COVID-19.
According to Zhang et al. 2020, male patients is 55.4% more likely to die from COVID-19 compared to female patients. Women are less vulnerable to viral infection than males. This is probably due to the protection provided by the X chromosomes and sex hormones.
According to the study by Bharati et al. 2020, people with underlying illness have a greater risk of contracting the disease as well as severity from the virus infection. Next, Bansal et al. 2020 stated that COVID-19 infection is more likely in patients who have cardiovascular disease such as heart disease and hypertension. The existence to other cardiovascular disease is a significant indicator of death. Richter et al. 2020 stated that excessive body weight and obesity are now being linked to more significant COVID-19 disease and deadly results. Next, according to Public Health England, a BMI of 35 to 40 can increase the risk of dying from COVID-19 by 40%, while a BMI of more than 40 can increase the risk by 90%.
Due to COVID-19, it's not surprised that working people also struggles against the COVID-19. Based on Muntamuzi et al. 2021 study, shows that essential workers are at a higher risk of severe COVID-19 infection. However, non-essential, non-healthcare vocations are also at a high risk. The chance of contracting COVID-19 are highest in crowded and poorly ventilated areas. According to Huang et al. 2021, urban area has the highest total numbers of cases compared to rural area. However, some study found that 7 out of 10 highest ranked counties or confirmed cases per 1,000 were rural.
Generally, smokers can be divided into two types, which are active smokers and passive smokers. Shastri et al. 2020 stated that 1.4% to 18.5% of COVID-19 patients admitted to hospitals were smokers.
Logistic duration is a multivariable technique for estimating the likelihood of dichotomous outcome. It is frequently used in models including illness state. The objective of duration analysis is to find the best fitting, most parsimonious, and yet biologically plausible model.
In conclusion, there were 7 factors which may contribute to a person being infected by COVID-19. This includes having an underlying health condition, overweight, residential area, smoking, and demographic profiles such as age, gender, and occupation. However, some of the factors could be quite different from the previous study.
This chapter will consist of few sections. It will begin with the pilot study, research design, population and sample, sampling design, data collection method, and instrument. And in the last part, the researcher would elaborate on the method used to analyze the data. Pilot study is a study that was done before the actual fieldwork was performed. The pilot study also was carried out on a smaller scale compared to the main study. For this research, the researcher took 60 respondents.
The main interest is to determine the factors that contribute significantly to COVID-19 infections. For this study, the researcher was used primary data and a pilot survey. Age, gender having an underlying health condition, occupation, residential area, overweight, and smoking were examined. The study focused on people in Selangor since it has the highest numbers of COVID-19 confirmed cases in Malaysia. Out of 6.57 million people in Selangor, the study needs at least 385 people as respondents. The sample size was determined by concurrent sampling technique.
Sampling is a statistical analysis procedure that involves selecting a predetermined number of observations from a larger population. This study used novel sampling, which is classified as non-probability sampling. The respondents were chosen from among friends, family, and known individuals through social media platforms.
Data was obtained from all 9 districts in Selangor. The study chose a snowball sampling technique to select sample from population. This sampling technique is extremely speedy, easy, readily available, and cost-effective to conduct research in the large population.
The questionnaire was divided into 4 sections, which are Part A, Part B, Part C, and Part D. In Part A, the respondents will be asked whether they have ever done a swab test or not. Those who have done a swab test will go to Part B to answer questions about COVID-19 status. In Part C and Part E contain information about the COVID-19 infection risk factors. In Part C, the respondents will be asked for the demographic information such as their age, gender, marital status, weight, height, and occupation. The last section is Part D, which includes questions about respondents' characteristics.
The data analysis technique used in this research were descriptive analysis, logistic regression model, stepwise regression, odds ratio, and measuring model evaluation.
Result and discussion of the study are covered in this chapter. The sample size for the study was only 369, which is fewer than the sample size required. This is because some people find that COVID-19 related issue is too sensitive and making them too reluctant to respond. Descriptive analysis is used to characterize or summarize the data feeders inside of research. It may be representations of the entire populations or subset of population. In this study, the data collection descriptions was provided in the form of pie chart, frequency tables, and summary statistics.
Figures above shows the percentage of COVID-19 test result after doing a swab test. It can indicate that out of 369 of total respondents, 54% of respondents are tested positive for COVID-19, while the rest of 46% are tested negative for COVID-19. Based on the table obtained, the researchers indicate that 50.4% of the total respondents were male and the rest of 49.6% were female respondents. Meanwhile, the percentage of respondents that have an underlying condition is 30.9%, while 69.1% of respondents are not. In addition, the table also shows the percentage of respondents that have high-risk employment, with 60.7% and 39.3% of them have low-risk employment. Besides that, the percentage of respondents that come from an urban area is 71.3%, while the balance of 28.7% come from rural area. From the table, the researchers can indicate that 37.9% of the respondents are active smokers, while 72.1% of them are passive smokers.
Based on table, it shows that the mean age of respondents are 31 years old and the median age of respondents are 24 years old. The range of respondent age are from 5 years old to 64 years old, while the majority age of respondents are 22 years old. Besides that, the mean BMI of respondents are 24.91 and median of BMI is 23.89. The range of BMI of respondents are from 14.15 to 48.92 and majority of respondents' BMI are 19.03.
Logistic regression analysis was used to analyze the data. It was an optional analysis to ordinary linear regression that can deal with dichotomous and categorical dependent variables. The researcher used logistic regression rather than discriminant analysis because it is statistically more reliable and has fewer assumptions. Meanwhile, stepwise regression can be described as a method of fitting regression models in which the selection of predictive variables is done automatically. In this study, Stepwise regression method was used to achieve the second objective, which was to obtain the best logistic model in determinants of COVID-19 infection.
The equation of the estimated full model is shown in this table. The equation of the estimated reduced model is shown in this table.
For odds ratio, the odds are another way of expressing the probability of an event occurring, with a value of 0 means that the individual is tested negative by COVID-19 and 1 means that the individual is tested positive COVID-19, or it can be said that it already has been infected.
Based on this table, for a 1-year increase in the age of the person, the odds that person getting infected with COVID-19 is multiplied by 1.055. Next, males are 6.7% times more likely to get COVID-19 infection compared to females. Whereas, for 1 unit increase in the overweight of the person, the odds of the person getting infected by COVID-19 is multiplied by 1.063. People who have an underlying health condition are 3.56% times more likely to get COVID-19 infection than those without health condition problems. People who work in high-risk employment areas are 6.39% times more likely to get COVID-19 infection. Moreover, people who live in the urban area are 8.99 times percent more likely to get COVID-19 infection compared to people who live in the rural area. Last but not least, people who are an active smoker are 4.99% times more likely to get COVID-19 infection compared to people who are a passive smoker. Next, based on the reduced model of odds ratio in this table, it shows that for a 1-year increase in the age of the person, the odds of that person getting infected with COVID-19 is multiplied by 1.056. Then, people who have an underlying health condition are 3.7 times percent more likely to get COVID-19 infection than those without health condition problems. Whereas, for 1 unit increase in the overweight of the person, the odds of that person getting infected by COVID-19 is multiplied by 1.060. Lastly, people who are active smokers are 3.89% times more likely to get COVID-19 infection compared to passive smokers.
By using omnibus test, researcher can estimate whether there is any regression coefficients that significantly differs among all coefficients except for B null coefficient. For decision rule, the null hypothesis will be rejected if the p-value of omnibus test is less than 0.05.
Based on the table, it shows that p-value of the test was 0, which is less than 5% level of significance for both models. Therefore, it can indicate that there is enough evidence that the both information from independent variable will give better predictions for the risk of suffering from COVID-19 infection.
Hosmer and Lemieux test is a statistical test for the goodness of fit of a logistic regression model. The null hypothesis represents the logistic regression model fit the data well, while the alternative hypothesis represents the logistic regression model does not fit the data well.
Based on the table, it shows that the null hypothesis is accepted for the full model since the p-value is 0.379, which is more than 5% level of significance. Therefore, there is enough evidence to conclude that the logistic regression model for full model fit the data well. While for the reduced model, the null hypothesis is also accepted since the p-value is 0.178, which is more than 5% level of significance. Therefore, it can be concluded that the logistic regression model for reduced model is a good fit for the data as well.
For predictive efficiency model, there are differences between sensitivity and specificity. Sensitivity indicates that the probability that the test will be correctly identified a tested positive person refer to 1. Meanwhile, specificity indicates that the probability of correctly testing positive or negative.
Based on this table, the full model shows the value of sensitivity is 70%, specificity 79.3%, and overall percentage 74.3% respectively. Meanwhile, for the reduced model, it gives a good predictive efficiency result since the overall percentage for the model is 75.6%, which is greater than 60%. And the value of sensitivity is 71.5% and the value of specificity is 80.5%. Thus, it can be concluded that the reduced model is better than the full model since the value for overall percentage, sensitivity, and specificity value is higher.
What statistic is the statistical significance of each independent variable? If the p-value is greater than 0.05, the null hypothesis is not rejected. It indicates that the variable is not significantly contributing to the risk of COVID-19. On the other hand, if the p-value is less than 0.05, the null hypothesis is rejected. This demonstrates that the variable has a significant impact on the risk of COVID-19.
Based on the table for the full model of work statistics, it shows that the variable age, overweight, having an underlying health condition, and smoking contribute significantly to the COVID-19 infection since the p-value is less than 0.05 cut-off point. Besides, the variable gender, occupation, and residential area did not contribute significantly to the COVID-19 infection since the p-value is greater than 0.05. Therefore, it can be concluded that variable gender, occupation, and residential area should be dropped from the model. Based on the table for the reduced model of work statistics, it shows that variable age, having an underlying health condition, overweight, and smoking are significantly influence the COVID-19 infection since the p-value is less than 5% significant level.
This analysis was used to provide an indication of the amount of variation in a predicted variable explained by a model. The range of values is r² more than 0 but less than 1, where r² is logarithmically significant.
Based on this table, it shows that the Cox and Snell r² and Nagel-Karp r² for the full model is 0.271 and 0.363 respectively. Therefore, it can be concluded that both r² value indicates that the total variation of COVID-19 infection is about 27.1% and 36.3% can be explained by all the variables included in the model, which are age, gender, having an underlying health condition, overweight, occupation, residential area, and smoking. While for the reduced model, the value of Cox and Snell r² is 0.261 and 0.349 for Nagel-Karp r². Hence, it can be concluded that both r² value indicate that the total variation of COVID-19 infection is about 26.1% and 34.9% can be explained by the variables included in the model, which are age, having an underlying health condition, overweight, and smoking.
The study aimed to investigate the factors that contribute significantly to COVID-19 infections and to find the best logistic model in determinants of COVID-19 infection. Discussion is divided into two sections that focus on both objectives to make conclusion more understandable and much simpler.
The first section is to compare the difference between two models. Based on table, there are a few variables in the full models that are not statistically significant in explaining the determinants of COVID-19 infections, which are variable gender, occupation, and residential area, since their significance value is more than 0.05. Therefore, this variable has been selected to be dropped from the model. As the result, the entire variable in the reduced model in Table 2 is statistically significant in explaining the determinants of COVID-19 infection. Out of 7 factors I mentioned in literature review as previous study, it can conclude that the 4 variables, which are age, having an underlying health condition, overweight, and smoking, are the main factors that contribute significantly to COVID-19 infection. Then, the logistic model equation to predict the COVID-19 infection is shown below.
This table shows that there is a small difference in the results for each criterion for model evaluation between the full model and the reduced model. Based on the result of omnibus test, both models shows that the information from independent variables allows for better prediction for the determinants of COVID-19 infection. According to predictive efficiency model, it shows a good predictive efficiency since the overall percentage for both models is greater than 60%. In addition, Hosmo and Lemichaud test show that both models fit the data very well since the p-value of both models are more than 5% level of significance. On the other hand, both models for Cox and Snell r² and Nagel-Karp r² show a lower value in indicating the total variation of the determinants of COVID-19 infection since both models get a small range. Since there is a small difference in the results for the full model and the reduced model, this can assume that the conditions of both models are quite similar. Based on the difference between criteria for model evaluation on two models, it shows that the reduced model is chosen as the best model in determinants of COVID-19 infection.
For the recommendation to get a better result, the sample size for the data collection should be more than 500 observations. Next, since this study focused on the medical field, more independent variables should be included. Last but not least, in terms of community aspect, they can avoid COVID-19 infection by complying to SOPs set by the government.